Good afternoon, everyone. We will just wait a few moments for a few more people to join, and then we'll get started. Right, let's go ahead and begin. Welcome to our Q2 Advocacy Webinar here at Mended Hearts. So happy to have you all on. We've got a great presentation set for you today. In just a few minutes, we're going to introduce our speakers. But before we do that, just a reminder that this is a webinar, so you are in listen-only mode, but we do encourage you to put your questions into the Q&A box. The webinar is being recorded and it'll be available on our website and YouTube channel tomorrow. We also wanted to thank our partners. With their support, we are able to bring you education like this, and we are grateful for that support. And I'm going to now hand it over to our Troutman partners, Chris Baxter. Chris will present, and then we are going to have a new introduction to our guests today from the Heart Sistas. So Chris, please go ahead.
Yeah, hi everyone. Thanks, Mandy. I promise I'll try to keep my comments as quick as possible to make sure that our partners over at Heart Sistas have as much time as they need to talk to you about the Cardiovascular Disease Early Detection and Prevention Act, which I'm definitely looking forward to hearing more about. So if we could go to the next slide, please. Oh, one more. Great. So yeah, I just kind of wanted to kick things off by giving a high level overview of where Congress is right now. It's kind of crazy to think that we're already almost halfway through the year, and Congress still has quite a lot on their plate to do, with somewhat limited number of legislative days to actually get some of those things done. When you combine the House and Senate calendars, there's really only about a combined 15 weeks, legislative weeks remaining throughout the entire year. They have a week off for the July 4th holiday. You have the August recess coming up, which happens every single year. And then this year, because it's an election year, they have October off again. So, there's a really the number of legislative days that they have is really starting to dwindle, and there's quite a lot to do. For example, they have to pass all 12 of the yearly appropriations bills, which I'll talk a little bit more about on another slide. We are expecting them to pass what's called a continuing resolution to see them through the end of the November election, which is really just another way of saying they'll flat fund the government past the fiscal year deadline of September 30th, and then more likely to deal with these spending bills once they're all back from the midterm elections. But yeah, aside from spending, we have the annual National Defense Authorization Act. That again is something that Congress does every year. Typically that they wait till the end of the year to do that. There are dueling House and Senate housing bills that they've been kind of ping-ponging back and forth from the upper and lower chamber that they're still trying to get done. And then, of course, there's a FISA reauthorization. That's the Foreign Intelligence Surveillance Act that they're trying to either extend or potentially do a reauthorization, but there's been a few hang-ups there. But yeah, they might get a few of these things done before the November election, like I mentioned, but the more likely scenario is that some of these larger big ticket items are going to be addressed once they return to DC after November. Next slide, please. Yeah, again, just wanted to give some recent related activity for Mended Hearts. On June 17th, which was just today, the Senate Health Committee was considering the Charlotte Woodward Organ Transplant Discrimination Protection Act. That's a bipartisan bill that would prohibit discrimination against people with both mental and physical disabilities in the organ transplant system. So the House passed this bill last year. So it's great to see the Senate Help Committee taking it up now, and hopefully the full Senate will be able to vote on that, get that passed, and that will then be signed into law. Just last week, the House Energy and Commerce Health Subcommittee held a hearing to examine a number of bills that were all aimed at increasing transparency and lowering costs, excuse me, across the healthcare system. So, a couple of these bills, for example, would require hospitals to really make it more transparent for patients to know what they're going to pay before they have some of these, bigger procedures done. So, potentially they can shop around because, as things currently stand, it's very difficult to know what you're going to pay, after you have services or surgeries or treatments done at the hospital. So good to see the committee, keeping those issues top of mind, and hopefully they'll continue with that activity throughout the remainder of the year. And again, just before that, the Appropriations Committee passed their fiscal year 2027 Labor H funding bill. I'll talk a little bit more about that on the next slide because there's some good details there. But some other things that we're just keeping our eye on over the remainder of the year. There are bipartisan working groups in both the House and Senate working on 340B drug pricing reform. And again, if you're not familiar with what that program is it's a federal program that requires pharmaceutical manufacturers who participate in Medicaid to provide outpatient prescription drugs at reduced prices for eligible healthcare organizations. So, the groups have been working on this legislation for a long time. So we're hoping to see their proposals come out, at some point in the second half of the year. Again, as I kind of mentioned, we expect both the Senate Help and House Energy and Commerce committees to continue their oversight of healthcare costs via congressional hearings, and bringing agency and department heads down to the committees to testify on how they're trying to keep costs low, and that ties well in with the administration's efforts to lower prescription drug costs. Just last month, the Trump administration, for example, announced that they are bringing 600 generic medications to Trump RX. This was in a partnership with Mark Cuban's Cost Plus Drug company. And that's really meant to, have more transparent mail order discounts and bring those also available to Trump RX. So the administration has done a lot in the realm of drug pricing lately, and that's something that we're going to continue to keep our eye on. And finally, the last thing I'll note is just, you're probably seeing in the news a lot about, budget reconciliation. That's basically the process where, Republicans on the Hill have been able to pass some of these larger, broad packages without any Democrat support. They just passed one to get some Homeland Security funding passed. And, they're looking at potentially doing another budget reconciliation. We're calling it 3.0 with some healthcare policies. The reality is it's very unlikely that this is going to get passed in Congress this year. The House may actually introduce something with some healthcare issues, but again, I think getting something even passed in the House and then passed in the Senate to be signed into law is an increasingly unlikely scenario as we get closer to the November elections. Next slide, please. Yep, and as I mentioned, the appropriations committees have been busy passing their spending bills. The Senate hasn't started to get any of theirs out yet. There's been a little bit of a delay there, just trying to negotiate their top line spending levels. But the House has been very active. And I really wanted to highlight the NIH funding portion of their labor HHS education bill, because it was something that we advocated for during our fly-in earlier this year. So as I mentioned before, the House Appropriations Committee just finalized their bill on June 9th. Now the full House still has to vote on it and approve it, but the committee is the one that's been taking the action so far, and that funded the NIH at $48.8 billion, which was great to see because that was an increase of $100 million over what was enacted for last year's funding levels, and that includes a $4 billion, just over $4 billion for the National Heart, Lung, and Blood Institute, which is roughly a $23 million increase from last year's funding, which again was something that we advocated for. And it was also really encouraging to see some additional language in what's called their committee report, which was encouraging the National Heart, Lung, and Blood Institute to expand their research into a number of different issues that I'm sure a lot of our advocates care about, such as cardiomyopathy, coronary artery risk development in young adults, longitudinal studies such as the Framingham Heart Study and the Strong Heart Study, heart and valvular heart disease research. So again, I'll just say, this bill's not final. The full House still has to pass it. And the next step is for the Senate to release their version, and they'll have to eventually go to some sort of conference or reach some sort of agreement before final, NIH funding levels are determined. So that was a lot. That was really quick. But again, I wanted to make sure we have enough time for our partners to go over their content. And I will pass it back to Mandy.
Thank you, Chris. That was great. I don't know if there are any questions right now, but please feel free if you have any to put them in the Q&A or in the chat. We can come back to Chris after if there are any questions. But right now, we'd love to turn it over to our partners, our friends, Hyvel and Rosalind at Heart Sistas. And I'm not going to introduce them. They can introduce themselves. They'll do a fabulous job, much better than I could ever do. I'm going to stop share, and I'm going to let the ladies take it over. And thank you both for being here.
Thank you. Thank you, Mandy. I'll start and Roz will go ahead and finish off. I want to introduce myself for those of you who do not know who I am. My name is Hyvel Ferguson Davis. I'm the CEO and founder of Heart Sistas, an organization that educates, empower, and advocate, especially for women of color. And why I say that it's so important was back in 2014, I experienced a stroke, which led to a quadruple bypass and a heart attack. And throughout the journey of just dealing with the cardiovascular realm of not knowing or understanding the whole terrain of healthcare system, I understood there was some opportunities that were missed in my case, especially with dealing with everything. And the outcome is completely different of people of color. So as I started to learn in reference to how do I fight better? How do I get a hold of what's dealing with? I understand there was a lack of empathy, compassion, but those were always, I felt, opportunities to engage. And so I led my voice to the voiceless to understand that we're here, we want to be counted, we want to live. So through my journey of just dealing with the healthcare and heart disease, being a pre-diabetic, having a stroke, I understood that this was more that I could take on, so I needed community. So therefore, I started learning about how to mitigate loss of life, looking at comorbidities, family history. High cholesterol was a major asset I didn't know about. So I dig deep into basically learning how to take care of me from that standpoint. And so as I started learning, navigate, and I started to gain traction, understanding my community was uninformed, lacked information. And I felt that there was an opportunity to engage not only my family, but the people around me in my ecosystem to build something that is unpenetrable, but needed to be heard. And throughout the journey, we're going to talk about how I was basically diagnosed 12 years into my journey. And that should not happen. I was on the cath lab after experiencing my second heart attack. And this is after 10 stents inside of me. And I was told that I had 4 more blockages. And I told the doctor at that point, I want to be tested for everything because the next time I come to this cath lab or intervention, I'll probably be dead. And I started losing weight. I started taking my medication. I started truly showing up for myself. And here I am on the cath lab being diagnosed. And for someone who's dealing with, with heart disease, it plays on your mental aspect that you think that everything you've done is, you've done everything wrong. And I was trying to live. I was trying to see another day. And here I was. I took a deep breath because in the 12 years, I finally understood what I was dealing with. And I started taking a deep dive into what lipoprotein little a was. And I started to understand that. And once I understood, I started talking to my family members because I found out that it was a hereditary issue. So I told my family members to get tested. And I educated myself in everything I knew to live. And therefore, we started having these really conversations inside of our, a dinner table, our private family gatherings. And so a few years ago, I was fortunate to go to Tallahassee, and I went there, and I never knew the voice I had, but I just use it everywhere I can because I understood that every time I open my mouth is an opportunity to engage my community who has lacked information and who is left behind in most cases. And so I went to Tallahassee and I came back because I was disturbed by what I saw there. And I never knew that one voice had power. I took what I felt was a problem and we looked for solutions and how do we mitigate a loss of life? And I knew from my story, I knew if I was able to share it in a way to help other people gain traction, but I would say the openness to go far beyond and not take a denial or rejection or, hand over to somebody else. No, it's about advocating for oneself because we all want to live and want to go, at the end of the day, we all want to go home. And so we looked at what lipoprotein little a was. And we looked at cholesterol, we looked at the panels, and we looked for ways to mitigate and how my story could have been preventive. Now, we talk about science, and the science is clear. They can't prevent what they can't see or detect. And that was obvious in my case. And so, therefore, I got with my team, especially Roz, and we looked at statistic. We dug deep into what exactly we were dealing with the problem. And we looked for opportunities to address those issues. Someone facing heart disease does not have to have a stroke or heart attack. What about preventive measures that can mitigate the loss of life? Okay, one heart attack, okay. Another one, a stroke, quadruple bypass. It all could have been prevented. That's why we speak. That's why our voices are here. And we created the HR 8260, Cardiovascular Early Detection and Prevention Act, so that we could mitigate the loss of life. We could actually talk about these issues. We could raise awareness and address them. And we're so grateful the American Heart Association has changed the guidelines because there's new advancement in technology, therapies. But the simple fact is, if the people don't have it or understand it, it doesn't work. So therefore, we created a bill, and now Roz is going to take over and dive deep into the problem, but present the opportunities that we have to address the issues to save lives together. Thank you. Roz, you can take over now.
Thank you so much, Hyvel. My name is Rosalind Louise, and I am the Vice President of Heart Sistas, dealing with logistics and policy. And I am so thankful for Mandy and Heart Sistas and Chris. Nice to see you again for this opportunity to address, as Hyvel tells you, she tells the story. And sometimes, as many times as I've heard the story and I've seen it firsthand, it always resonates with me because she didn't allow her journey to be in silence. She took it and she said, it's time for me to advocate. And when she came to me in reference to this policy, to this request and say, hey, we need to write a bill, I was like, okay, let me go into my closet and let's figure out a way to come up with a bill that we could address this. So that's when it was drafted. And one of the things I want to thank Congresswoman Sheila McCormick is the one who introduced it into Congress before she left, and it now sits on the Judiciary Committee. So let me deep dive into what this bill, to simplify it, what this bill does. This bill is, this legislation, I would say, is the potential to save, like Ivel said, thousands of lives by ensuring that individuals at the highest risk of cardiovascular disease have access to advanced screening before tragedy occurs. During my studies, I found out that 1 in 5, that is 1 in 5 persons are walking around with an elevated little a and don't even know it. Why? Because of the fact that this is not part of the lipid panel test that happens. So this bill ensures that those people who are at high risk or who have suffered a cardiovascular event or who have a history of cardio event in their family can get now this lipid part of the lipid testing on their when they go out and get testing. So one of the things that we did is when we researched, we understood that 50% of heart attack survivors die within the 5 years. This bill helps to ensure that once we get tested, because we know it's a genetic component. So once they get that test, it's not a cure, but it's prevention. And what we hear at Heart Sistas, which I love about the organization, is that we're in here to do prevention. And we understand that policy plays a part in that. And the great thing about this bill, it is at no cost to the individual, where we can have Medicaid and private insurers come in and subsidize. One of the things that I learned about this lipoprotein, we learned about the test and the cost, is $35 to get this test done. And what that implies is that that's around $2 to $4 billion that what we can do to prevent in reference to the healthcare, because we know that 90% of diagnosis happens in the ER, and that takes a toll on the healthcare system. So not only is this bill a prevention, but also in helping to that toll, that dollar amount that the healthcare system is suffering right now, because so many people, when they go to the ER, they're either uninsured, underinsured, or don't even have insurance. And reason this would help is because that will be a cost saving to the doctors, the patient, and overall to the healthcare system. So what we were asking is that we looked at it and we said, what are the 5 key components of this bill that's going to help to bring this bill along? And one of the things that we talk about is the bipartisan, because we understand that everyone is affected by cardiovascular. So we went into Congress, and we have several congressmen that are congresspeople that are looking to work alongside us. And one of our key components outside of former Congresswoman Sheila McCormick is Congressman Troy Carter. He has been, when he heard about this bill about a year ago, and he was like, just sign me on. I will do whatever I can to make sure that we can get this bill across the aisle. So with the help of Mended Hearts and everyone here, our goal is to see what we can do to bring this bill across the finish line, because we understand the importance of this bill. I don't want to take too long and go into policy and the nuances, but one of the things, like I said, the most important part that we all understand about HR 8260 is that it's prevention. It's putting that lipid little a onto the testing part of a lipid panel. So with that being said, I think that's more of it. I don't want to go into the nuance of the politician, but if you have any questions, I'll be free to answer any questions that you have of Ivel or myself, and then we can take it from there.
Yes. And also the call of action really is to make sure that we are aware and we want partners so that we can actually push the agenda, because we know every time we open our mouths, lives are being saved, even with a conversation, which is so important, so that people can be more empowered to speak and even go to their doctors and demand this test. So I think that we started something which is a conversation starter, which is so great. And we are open and welcome to partnering, and anyone that wants to go ahead and help us as far as making sure that we have what we have need to get this built, or basically to make sure this society or people at large know what's going on, because the science, like I says, does work, but there's a gap that's missing and opportunities to spread awareness.
Thank you, Hyvel, and thank you, Rosalind, and thank you for also giving people, sharing your personal story, sharing the power of what drove this, but also giving people some action steps on how they can help, because that's what we want to do. We want to help, whether it's a patient organization on here or individuals. So we will try to share your email address, or if one of you could put it in the chat, the contact information for the organization Heart Sistas. We'd love to hear, I think we've got actually a question in the Q&A, so let's do that. Yeah, Susan asked, do you have a one-pager on this bill? So
Yes, we do. Yes, we do. We do have a one pager, and I could forward that over. And then yes.
that's great.
Mm-hmm.
Susan, we'll message you maybe privately and get your information so that we can send you that one pager. Or actually, what even better, tomorrow when we send out the link to this recording, we can include that one pager when we do that, along with Hyvel and Rosalind's contact information. Can you tell, you guys are both doing great work in Florida. Would love to hear a little bit more about what Heart Sistas does, your mission, and also when you're having these conversations around LP(a) in your community, are you seeing a change in people's awareness from what, a lack of complete awareness maybe 3 or 2 years ago? What are you seeing now? Would love to hear.
Yes. First, I want to thank Mended Hearts. Mandy, you know how the organization, I was in dire straits when I found you guys, and I found you guys. I'm so important. So that hospital visit was everything to me. And it gave me hope when I did not have hope, because I was 41 when I had my heart attack. And every news I got was not good, but I had someone to come and says, I see you, I hear you. And they gave me a pamphlet. And I actually still have that pamphlet today. So I thank Mended Hearts, because Mended Hearts is my home. You know that. And I'm so grateful that you, just pick up, and you're always willing to share our information. So who we are is that after I found out that I was dealing with something, I had no idea. I had no tools. I had absolutely no tools. I was sick and I was dying. But I knew I had to learn everything, not for myself, but my family started first. And so we had to change the trajectory of my family and my path. So I started diving deep into health, something that we don't address in our community and in our household. We have all the comorbidities, hypertension, diabetes, high cholesterol, but yet again, we are dying and not even talking about it. And so as I started understanding, I went to an event and a doctor said, heart disease and strokes are 85% preventive. Can I say it again? Because it changed my life. 85% preventive. And I knew that I was in a space that I needed to be. And as I started going to my communities, looking at, the corner stores, looking at, the social determinants of health, I knew we did not have the tools. I didn't have the tools. Therefore, I made it my personal mission, because isolation does not work. I had suffered a heart attack and stroke, but my family was collateral damage. Therefore, we started doing work together. And as I started looking at my community, there is so much to be done in our community. And that's why you see us, we're so active, because every person we touch, when we open our mouths, it's saving a life. We don't have hope. And we bring hope to the hopeless. We bring a voice to those who need the voice. We bring awareness that you can take back your life. And we meet people where they are. We understand, we see, we understand you're dealing with so much issues that, you put your health on the back burner because you're addressing all type of issues. So we go in, we advocate, we educate, and we basically hold their hands. And we do it in a non-conventional way, because more than likely, we're not going to the doctors. But we go out to the baseball field, the football fields. We bring them into our community, and we go to the churches. We have events where it's in a beauty salon or barber shop, because we know the touch points are not where our community is, but we know we have to immerse ourselves so that we can address our problems by first they seeing that we're there. Because there's such a gap or mistrust when it comes to, I would say, pharmaceutical, because we don't want to take the medication because there is history of mistrust. So what we do is we have these conversations saying that we see you, we hear you, but it's us having these much needed conversations. Isolation does not work, but what does work is community. And we understand the underlier is that we have to build an infrastructure, and we are like the gatekeepers to our community because they listen to us. And we're so grateful for the partners that we do have, because we're penetrating, we're opening a door into something that's needed, because there's so much opportunities for engagement, and there's so much opportunities to save lives. So that's what Heart Sistas is about: catching, reaching, teaching, because no one's left behind.
And as Ivelle continues to tell about what Heart Sistas has with our organization, and like she says, we meet people where we're at. And Mandy, when you talk about how you've seen how we've seen the difference, and when we talk about lipoprotein A to people and the difference of knowledge and educating, and a lot of them are like, "Are you kidding? I can have this done, and how do I get it? What do I have to do to get it?" So one of the things I'm thankful we had partnered up initially with our family Heart, where we provide kits, home testing, where they can go ahead and get the testing done and they can get the results. So we meet them. We have community events. For currently this week, next Friday, we have one where we partnered up with a cardiovascular doctor in the community where he has testing done. And so we're going to be opening that up where families can come and get tested next week. So, and educating them on that matter. So a lot of people, when we first mentioned, the first thing is, what is it? What does it do? How come my doctor didn't tell me about this test? How do I get it? So that being what Heart Sistas does, we come in and we inform, and when Heibel talk about educating, and that's part of the educating aspect of what Heart Sistas does, is making sure that they understand that this is vital to their life. This is important. And when they say 1 out of 5, I said, yes, there's 5 of us in this room, and 1 of us has an elevated little a. That's how we make it transformative, and they can understand and they can relate. And when that happens, they're like, okay, I want to learn more. How do I prevent it? What do I have to do? So that's one of the things that we pride ourselves at Heart Sistas in referencing, making sure that that information is in the community, in that, it reach one so we can teach one.
Yes. What Roz did not mention is that event that we're having next week. It's going to be in Little Haiti. And this is a community, dealing with the terrain. We're dealing with they're not going to their doctors. And we're going to actually have an event so that they can come out and get tested and medical, testing done. So we're reaching that subset that no one's looking at, but they need the help. And so we go, we partnered with a few Vivi, also a Spanish community in Miami, that, we're touching at people where they are, addressing our community at large.
Amazing. Both your ability to partner with other organizations and the understanding that when you do that, really everyone benefits, but just your drive is fantastic. We applaud you. Thank you guys for sharing. There's something, Johnny, we will send out the contact for Heart Sistas tomorrow when we send out the recording, so keep an eye on your email. Are there any other questions you want to put in the chat? Thank you everyone for being here. If there's nothing else, ladies, keep up the great, yeah.
We have some quickly I can talk also. We have a new campaign
that
we can talk about. It stops with us. And basically, we're taking a declaration saying that we're going to take care of our own health. We're going to advocate for our own rights by, it's going to be a 2-year campaign where we're bringing on women that have faced, stroke, hypertension issues, heart attack, stroke, even, heart disease, even cancer, because we know it's all linked. And so we're looking at the community. We're making women, they're going to be our first inaugural Heart Sistas ambassadors. So now they can go out and reach and teach others. So this campaign we're looking forward to, it's going to be a major undertaking, but it's something that it's needed because we're going to empower women to take back their health and demand care because we understand the outcome, and I talk about this a lot, especially when I go, away, we understand that, women are affected by heart disease more than ever. But if we look at the outcome of women of color, it's completely a crisis in our community. So we can't lump it in the same category. And I thank, for organizations for understanding the impact that we're doing in our community. So, and also Mended Hearts and many of the pharmaceutical companies understand that there is a major crisis in our community and we're meeting that need and we cannot lump it in the same category because our outcome is completely different. And I want people to really understand that.
That's great. And Hyvel, that program is then virtual, so people can join from anywhere, not just Florida.
Yes, it is. It is. Yes. We actually
Okay.
start our first cohort this Wednesday
Okay.
in training. Yes.
Yeah, it will be next Wednesday, June 24th.
Next Wednesday.
Yeah, we start our first cohort. And like Hyvel said, the importance of this program is just simply like it says, it stops with me, it stops with you, it stops with all of us, because no longer are we going to accept you could go ahead, go home and deal with it. Go ahead, we're not doing that anymore. We're saying this is it. Our kids are not going to have to deal with this anymore. And Heart Sistas is in the forefront, fighting this battle, not just for ourselves, but for each individual. And that's what makes I like to say what makes us a unique and we have a niche is that we can bridge the pharmaceutical companies and the community. We are in the middle to bridge because so long, especially within our community, the distrust that is out there when it comes to medicine or doctors or whomever it is, and partner up. So as long as Heart Sister says, hey, we've partnered up with this particular organization and we're bringing them into the community, they understand that this is a trusted partner and they are open and more welcome to listening and understanding the importance because, we bridge that with science and medicine and we make sure they understand the importance of going to their doctors.
Yes. And what is so important, Mandy, is that we don't have to wait for a decade. Every time we open our mouths, we know we're saving lives. And that's the why we're so vigilant in our community and active.
No, you are. Well, guys, the chat is very active. Jim has said he's a creative director. If you need volunteer help with campaigns, please reach out. So Jim will send that contact info tomorrow. Hilly is on, singing your praises. And Hilly is with Family Heart, which does those LPA testings, guys. So reach out to Family Heart if you're on the call and you're interested in getting a free test mailed. And just so grateful for you guys. And please reach out to Heart Sistas with any comments, help, getting yourself involved in their training, what have you. But thank you both, ladies.
And before I leave, I want to everyone, please, if you can call your local congressman, reach out and tell him, please support HR 8260. Just go and call him, make that call, and we would appreciate it. That's how come if anybody wants to help out, that's one way that you definitely can help is to call your local congressmen and senators and tell them get on board with this bill because it's saving lives.
And also partner with us because it's desperately needed in our community. We thank you.
All right. Thank you, ladies, so much. Thank you, Chris from Troutman, for being on. And have a great evening, everyone. And Heart Sistas, best of luck with the bill.
Thank you.
Bye.
Bye.